Hello everyone and welcome to my channel. Today we're going to delve into an important and often misunderstood topic, bipolar affective disorder, also known simply as bipolar disorder. We'll cover the different types of bipolar disorder, the symptoms, and clarify some common misconceptions. Let's dive right in. It's a condition that impacts how a person feels, thinks, and behaves. This disorder is characterized by extreme mood swings that include emotional highs, known as mania, or hypomania, and lows, known as depression. These mood swings can be intense and unpredictable, making everyday life a challenge. Imagine waking up one day feeling like you can conquer the world. Your confidence is through the roof, and you feel unstoppable. You're full of energy, talking a mile a minute, and taking on more projects than humanly possible. Your mind races with ideas, and sleep feels like a waste of time. You might even engage in risky behaviors or make impulsive decisions that you wouldn't normally consider. Then, seemingly out of nowhere, you crash. The high energy and euphoria vanish, replaced by a crushing sense of despair. You can barely get out of bed, everything feels hopeless, and you wonder if you'll ever feel joy again. The simplest tasks feel insurmountable, and the world seems like a dark, unwelcoming place. This drastic shift can be incredibly disorienting and debilitating. That's what living with bipolar disorder can be like for many people. These drastic shifts in mood and energy can make it difficult to maintain relationships, hold down a job, or even take care of oneself. The unpredictability of the disorder can lead to a sense of instability and fear of the next episode. But here's the good news. Bipolar disorder is treatable with a combination of medication, therapy, and lifestyle changes. Many people find stability and relief from their symptoms. Medications such as mood stabilizers and antipsychotics can help manage the extreme mood swings. With the right help and support, people with this condition can lead fulfilling, productive lives. Support from family, friends, and mental health professionals can make a significant difference. Therapy can provide coping strategies and a safe space to navigate the emotional turbulence. We're going to dive deep into bipolar disorder. We'll explore its symptoms, causes, and the various treatment options available. We'll also discuss the importance of early diagnosis and intervention in managing the disorder effectively, because knowledge is power, folks. Understanding this condition is the first step towards empathy and support for those who live with it every day. By educating ourselves, we can break the stigma and offer better support to those in need. Let's get one thing straight right off the bat. Bipolar disorder isn't just about mood swings. We all have ups and downs in life. That's normal. But bipolar disorder is something else entirely. It's a serious mental health condition that affects mood, energy, and ability to function. Think of it like this. Your mood is like a thermostat. For most people, it stays within a comfortable range. With bipolar disorder, that thermostat is broken. Sometimes it's cranked up to scorching hot, other times it's freezing cold. Bipolar disorder involves extreme mood episodes. These episodes aren't just fleeting moments, they affect every aspect of life: sleep, appetite, energy, judgment, and behavior. Let's discuss bipolar 1 disorder. This is what most people think of when they hear bipolar. It's characterized by manic episodes. These are intense periods of elevated mood and energy that last at least 7 days, or they're severe enough to require hospitalization. During a manic episode, a person might feel on top of the world. They're bursting with energy and ideas. They might talk fast, jump from one topic to another, and feel like they don't need sleep. Some become more creative or productive. Others might engage in risky behaviors like excessive spending or unsafe sex. After a manic episode, many experience a crash. That's why proper treatment and management are crucial. Let's move on to bipolar 2 disorder. Often called the milder form of bipolar disorder, there's nothing mild about it. It's a serious condition that can significantly impact a person's life. The main difference is in the type of up episodes experienced. In bipolar 2, instead of full-blown manic episodes, people have hypomanic episodes. These are similar to manic episodes, but less severe. However, people with bipolar 2 often experience more frequent and longer-lasting depressive episodes. Don't be fooled by the term milder. Bipolar 2 can be just as disruptive to a person's life as bipolar 1. Manic versus hypomanic episodes, understanding the difference. All right, folks, let's break down the difference between manic and hypomanic episodes. This distinction is crucial for understanding the nuances of bipolar disorder. Knowing these differences can significantly impact how we approach treatment and support for those affected. This is important because it's the key distinction between bipolar 1 and bipolar 2 disorders. Recognizing these differences can help in accurate diagnosis and treatment. Proper diagnosis is the first step towards effective management and can make a world of difference in the lives of those living with these conditions. Both involve elevated mood and increased energy, but the severity and impact are different. Understanding these differences can help in managing the conditions more effectively. By knowing what to look for, caregivers and medical professionals can tailor their approaches to better suit the needs of the individual. Manic episodes, which occur in bipolar 1, are intense and severe. They can significantly disrupt a person's life and may require hospitalization. These episodes can be so overwhelming that they interfere with daily functioning, making it difficult to maintain relationships, work, or even take care of oneself. A person might feel euphoric or irritable. This can lead to unpredictable behavior that can be challenging for both the individual and those around them. The mood swings can be so extreme that they create a roller coaster of emotions, leaving everyone involved feeling exhausted and confused. They might have racing thoughts and speak so fast it's hard to keep up. This rapid speech can make communication difficult and can be overwhelming for listeners. It's not just the speed of speech, but also the content, which can jump from one topic to another without any logical connection. They might start multiple projects at once or make grandiose plans. These plans can often be unrealistic and lead to disappointment or financial trouble. The impulsivity during these episodes can result in risky behaviors such as excessive spending that have long-term consequences. Some people experience delusions or hallucinations during severe manic episodes. These symptoms can be frightening and may require immediate medical attention. It's crucial to seek help as soon as these symptoms appear to prevent any harm to the individual or others. Hypomanic episodes, on the other hand, are less severe. They are often shorter in duration and less disruptive to daily life. While they may not be as intense, they still require attention and management to prevent escalation. There are still noticeable changes in mood and behavior, but they don't cause the same level of impairment. People might feel more productive and creative during these episodes. This increased productivity can be beneficial, but it can also mask the underlying issues that need to be addressed. Even though hypomanic episodes seem less severe, they can still lead to poor decisions and relationship problems. It's important to recognize and address these episodes to prevent long-term consequences. Early intervention can help manage symptoms and improve the quality of life for those affected. Debunking myths. Bipolar disorder isn't just mood swings. Now let's clear up some misconceptions about bipolar disorder. It's a complex mental health condition that goes far beyond the simple ups and downs we all experience. It's not just a matter of feeling happy one moment and sad the next. The reality is much more intricate and requires a deeper understanding. One of the biggest myths is that it's just about having mood swings. This couldn't be further from the truth. Mood swings are common and happen to everyone, but bipolar disorder involves much more severe and prolonged mood episodes. Folks, we all have mood swings. It's a natural part of life. We might feel elated when we receive good news or down when things don't go our way. That's part of being human. We might feel happy one moment and sad the next, but these changes are usually brief and manageable. They don't typically interfere with our ability to function in daily life. But bipolar disorder is something entirely different. It's a serious condition that requires medical attention and understanding. The mood episodes in bipolar disorder are not just intense, but also prolonged. In bipolar disorder, mood episodes last for extended periods, days, weeks, or even months. These aren't fleeting moments of joy or sadness. They can be so severe that they disrupt a person's ability to function in their daily life. They're not quick shifts in mood like we all experience. Instead, they can be intense and disruptive. These episodes can significantly impact a person's relationships, work, and overall quality of life. These episodes also involve changes in energy, activity levels, and the ability to carry out day-to-day tasks. It's not just about feeling up or down. During a manic episode, a person might feel overly energetic and unable to sleep, while during a depressive episode they might feel exhausted and unable to get out of bed. Another myth is that people with bipolar disorder are always either manic or depressed. This isn't true. There are periods of stability where the person feels relatively normal. Many people with bipolar disorder have periods of stable mood in between episodes. These stable periods can be quite long and are a crucial part of managing the condition. It's during these times that individuals can live their lives without the interference of extreme mood swings. The goal of treatment is to minimize episodes and extend these stable periods. With the right support and medication, many people with bipolar disorder lead fulfilling lives. Treatment often includes a combination of medication, therapy, and lifestyle changes to help manage the condition effectively. Bipolar depression versus major depression, not the same thing. Let's talk about depression, folks. Many people don't realize that bipolar depression is different from major depression. Yes, they share some symptoms, but there are important distinctions. Understanding these can be crucial for proper diagnosis and treatment. In both types of depression, a person might feel sad, hopeless, or lose interest in activities they usually enjoy. They might have trouble sleeping, experience changes in appetite, and have difficulty concentrating. But in bipolar depression, there are often some unique features. People might sleep more rather than less. They might gain weight instead of losing it. They often feel physically slowed down or agitated. Managing bipolar disorder, a multifaceted approach. All right, folks, let's talk about managing bipolar disorder. This isn't a one-size-fits-all situation. Effective management typically involves a combination of approaches. Medication is often a key component. Mood stabilizers, antipsychotics, and sometimes antidepressants can help regulate mood and prevent episodes. Psychotherapy is another crucial piece of the puzzle. Cognitive behavioral therapy, or CBT, can help people identify and change negative thought patterns. Lifestyle changes play a big role too. Regular sleep patterns, a healthy diet, and consistent exercise can help stabilize mood. Bipolar disorder, a medical condition, not a character flaw. Now let's get something straight. Bipolar disorder is a medical condition, not a character flaw or a sign of weakness. It's a disorder of the brain that affects mood regulation. It's not something a person chooses or can simply snap out of. Think of it like diabetes. We don't blame people for having diabetes. We understand it's a medical condition that needs treatment. Bipolar disorder is the same. It's caused by a combination of genetic, biological, and environmental factors. It's not caused by personal weakness or a lack of willpower. Seeking help, the first step towards a better life. All right, folks, let's wrap this up with the most important point. If you think you or someone you love might have bipolar disorder, seek help. Don't suffer in silence. Reach out to a mental health professional. It's the first step towards a better life. I know it can be scary to ask for help. You might worry about being judged or labeled. But remember, mental health professionals are there to help, not judge. They've seen it all before. You're not alone in this struggle. Early diagnosis and treatment can make a world of difference. It can prevent episodes from becoming severe. It can help you regain control of your life. Don't wait until things get worse. The sooner you seek help, the better. Thank you for joining us today. If you found this video helpful, please like, share, and subscribe to our channel.